program, and it was very, reassuring to hear of all the people that came from different backgrounds, because I originally also was not looking at policy. But I was just curious, I know about the internship program and the Margolis Scholars Program. I was wondering of any other ways to get involved with the center.
So right after the Q&A, we'll actually go over all of that. So you're ahead of the game. And yeah, so we'll go over some different ways that you can get involved, as well as some upcoming projects and things that you can join as well. It looks like we have a question from Sydney. Sydney's asking, what does your day-to-day lives look like?
That's a great question. I'll start. So my day-to-day currently looks like sitting in this exact room because we're doing everything virtually. So I still see patients at UNC one afternoon a week. So Tuesday afternoons, I'm seeing patients on the computer. Otherwise, I'm doing research and with Margolis all the time. And so it looks like pivoting from different research studies to different research studies, doing Zooms. Sometimes I'm coding data. That's what I was doing yesterday afternoon. Some days I'm creating what's next, thinking about what question do I want to answer next and how am I going to get funding to do that. So I would say every day looks different, but it is, I'm really enjoying this, even though it's, in a pandemic. There's definitely some bright spots to still being able to connect in this way. And I think in some ways I've been able to do more than I would be able to do had I obviously had to run across campus and do all the different things that it would have meant if we were still doing face-to-face.
How about Bristana? Do you want to answer that question?
I'm glad to add on to that. So as faculty, I have a lot of different projects and a lot of different stages. And so I guess I'll kind of just talk about the different stages of projects because that really drives what my day-to-day looks like. So first you're writing grants. So that's an important bucket, dreaming up the idea, like Michelle said, and then collaborating with other people to get their perspective and to improve your idea. In policy, a lot of our projects are interdisciplinary. So for me, that's one of the things I really love. We get to work with clinicians, we get to work with policy analysts, we get to work with statisticians and health economists, hospital administrators, the state Medicaid program, the federal policymakers. So there's a lot of different stakeholders and perspectives to consider when you're conceptualizing a research project. So I really enjoy that. I work with big data, so creating statistical analysis plans with the statisticians. I also do some programming in Stata and SAS to produce the study results. And then writing papers and publishing, because none of the work matters if you don't get it to the people who are making the decisions and the people who are providing care. So in addition to publishing in peer-reviewed journals, we want to also do policy briefs or Twitter, any way that we can communicate the findings and results so that it can actually impact care and improve population outcomes. Yeah, I guess that's pretty good. I work with students too, mentorship. Mm-hmm.
Great, thank you. Hillary, do you want to go next?
Sure. Yeah, I think it's funny. It's like right now, every day looks the same. There's different stuff happening every day, but from the outside, it sure just looks like I'm sitting at the same desk the whole time. But in general, both when we're in person and now on Zoom, there's the different activities involved. And I think, people have covered up with the research, kind of the research portions of it. In addition, the Margolis Center does a lot of projects that involve convenings. So that's getting a lot of people that have different perspectives or a lot of knowledge on a certain subject in a room or a Zoom room to and giving them materials in advance on the subject that they need to talk about, and it's a lot of it takes a lot of intense work and careful, detail-oriented work to get materials together and to make those meetings happen in a good way that you can basically get a summary of like, here's what a bunch of experts think about this, and turn that into policy recommendations, and good analyses going forward. So organizing those convenings is a big part of both my job and a lot of people at the Margolis Center's job. And then I'll just add, right, and for our faculty members too, there's teaching. So designing courses, figuring out how to implement them, more online if they haven't been online before. We've been doing that, and then just and teaching and answering students' questions and grading assignments. That's all part of it too.
Okay, thank you, Trevor.
Yeah, so I guess my role is primarily in research. I don't have a lot of teaching responsibilities. So even though I'm a physical therapist, I don't teach within our DPT program or Doctor of Physical Therapy program. So I'm primarily on a research track, and so I guess it's funny to ask this question right now with a few NIH deadlines here coming up pretty soon. A lot of the work, a lot of my day looks like grant writing, and oftentimes that stretches well into the night, to be quite honest. And it's because it's really based on deadlines and things that may be coming ahead. It really can be some long days and nights of grant writing. A lot of manuscript writing, as Rosanna brought up. I do a little bit of mentorship, but I do think that every day looks a little bit different in terms of what I'm doing, which I think really makes it attractive for me. I like waking up and doing something a little bit different each day, even though it may be sitting in front of my computer doing it. There are always different types of things that I'm focused on, and even if it's with a particular grant, maybe I'm working on different aspects of it, and collaborating with different folks to try to get certain things done. So I think the variability is what I really enjoy a lot, and even though sometimes those days can be very long.
Great. Also, Trevor, it looks like there's a question for you from Lane. The question is, what methods do you use for identifying barriers to implementing interventional pain management?
Yeah, hey Lane, that's a good question. So the methods that we're using for this particular project that I was talking about is largely qualitative methods. So we're doing interviews with healthcare providers and administrative staff and payers. They're all online now, obviously through Zoom. But we did have a roundtable, I guess it was early last year, back in February, it seems like it was so long ago, where we had an in-person roundtable. We brought together a number of payers and policymakers and health care workers and actually patient representatives as well, to try to figure out sort of what are the major issues within integrated pain management. And then now a lot of it is focused more on interviewing specific stakeholders, and we've actually just started a phase of the project where we're doing case studies. So interviewing a number of people associated with individual programs, and then going forward and writing up these case studies. There are other things that I've done previously to look at these programs that are a little bit more quantitative focused. Those tend to be more descriptive, so looking at how people use care using things like Medicare data or survey data, but primarily for the project that I talked about, it's largely qualitative.
Great. Okay, we have a question from Chris. Could you talk about the process of identifying a research mentor? I'm not sure who this question is for.
I could speak first, I guess. If that's
Sure.
helpful. So I think part of it depends on the stage that you're at. If you're going into a master's program, that might look different than if you're going into a PhD program. And then at faculty level, we still have research mentors, and that's still a very important relationship. So thinking about as a student, when I was considering different programs and talking to who would be a good research mentor, there is a content. It's helpful to have someone who is interested in the same area of research that you are, but also your content can kind of evolve and shift over time early in your career anyway. So you start with someone who has a content area that you are interested in, but just know that can also change. And I think having someone that you communicate well with is really important. So you can look at some people on paper and it seems like their research overlaps a lot with your interests, but having a conversation with them to see how your styles mesh and how you're able to work together, I think is really important. So I would really recommend having a conversation or multiple conversations and talking with multiple people too, because you might find, someone that you maybe didn't expect to have that strong connection with when you have a conversation that comes through. So I don't know if that's helpful. That was kind of my experience.
And I think things like going to the Margolis seminars, which we'll probably talk about at the end of this. If you're a student that just kind of wants to get started, doing research with a mentor, I think getting a feel for what's out there by attending a lot of events and just seeing faculty talk about their research and then reaching out to them about anything you find particularly interesting is one way to get started.
Yeah, I think one thing I would add is that, particularly at an undergraduate level, I recently, I guess about a year ago now, had a student that he was a freshman. He was an undergrad freshman at Duke, and he just, had done some work with in Arizona around autism, and he really wanted to continue that interest at Duke. And so another student introduced us, and he was super interested in what I was doing, and he said, "Can I help? Can I get involved?" And so we did that. So he's working alongside of me on a project, and I'm mentoring him through that too. And he certainly didn't know what, it started with a conversation. And I think sometimes it's just going, "I'm really interested in that. Is there any way I can get involved?" Sometimes it means donating your time. Everything's not obviously funded always. Or it's talking with somebody about what you're interested in, and they know that you need to meet this next person. So I think it's fun to see how that evolves over time.
And Chris, maybe one of the things that I'll add just very briefly is, talking with people who they've mentored in the past, talking with prior mentees is helpful. I know that was very helpful when it came to me picking out, who was going to be my PhD mentor or postdoc mentor. And it's helpful to talk with the folks that have been through either a lab or been under the mentorship of whoever you're interested in being your mentor.
Great, thank you. I think we had a question from Georgina.
Yeah, hi, I'm Georgina, and I'm interested in PhD in health policy. I'm a political scientist in Mexico. So my question is, it is possible to do research about mental health policy, but with a sociological or political focus? That's my principal question.
Yeah, so is that possible? 100%. It sounds like that's something that you should do. So certainly, kind of figuring out in terms of your PhD, kind of what school you would sit in to do that best. Would that be sociology? Would that be, more of a psychology where, you can kind of do your PhD in one area, but recognizing your research really spans different areas, and certainly the political arena too. So you dream it up, you can make it happen, and so I did my PhD in a school of nursing, but I could have done the same research in a, with psychology in different types of PhD programs. So I think sometimes that is the challenge, to figure out, what specialty you're going to do your PhD in, but recognize that you can broaden that, after you finish that PhD program. It sounds really cool.
Okay. Thank you.
Mm-hmm.
Great, thank you. Does anyone have, I think we have time for maybe one more question. Okay. Do any of the panelists want to give any concluding thoughts or anything like that?
I guess
Yeah. Oh, go for it.
Who's that? Oh no, Hillary, go.
All right. I would just say, if you're any kind of pre-professional student, or you have a sense of the career you want, then do as much as you can to spend time with people that are, so if you're a pre-medical student, or you think you are, or pre-whatever student, spend time with students that are medical students, or I think a lot of people either shadow physicians or they do student pre-med programs. But what was really valuable for me was spending time with pharmacy students when I was a pre-pharmacy student. But generally just kind of read and get involved and go to stuff widely, and get involved in things that even aren't pitched directly at students, and just kind of get in there with people doing their actual jobs. I think that's really valuable.
That's so good. And I will just say, and particularly when I was a clinician and knowing that I needed to move into a health policy space, but not knowing how to do it, I found it very intimidating. I found things very complex in terms of the landscape, how decisions are made, who makes the decisions, all of that. I certainly still do not have all the answers, but I would certainly say that that is always an important part of every research, every clinical decision. These things matter. So the more that I've just leaned into that discomfort and tried to learn more, it has helped. And I've had mentors that say, so in terms of a policy perspective, how are you thinking about that? And made me really uncomfortable, because I was like, I don't know, I just think it's a really interesting research question. And, finding that, how would this research be sustainable in terms of policy, and really asking very different questions and thinking about the policy implications up front instead of at the back end, which is, I think, the way I kind of intuitively or naturally first was thinking about it. So just know that if you're here, you're probably already really interested in it. Even if you're really scared, like, you're still supposed to be here. It still scares me, but it scares me more to not be involved and to not be at the table for what that means for the people that I care about.
Great. Thank you so much. So thank you to everyone for your questions. We're now going to move forward in our open house, and I'll be telling you a little bit about how you can engage with our center. And also panelists, if at this time, if you need to go attend other meetings or anything like that, please feel free to jump off if you need to. But thank you. One of the first ways you can get involved with the center is by joining a BASS Connections team. The center has applied and been accepted for a multitude of BASS Connection projects throughout the university. These projects assist to bridge the gap of the classroom and the real world, and give students a chance to roll up their sleeves and tackle complex societal problems alongside faculty, staff on interdisciplinary teams. So on this slide, it's just a snapshot of the projects our center is involved in, and you can see the full list on our website underneath the Education tab. And if you're interested in getting involved with one of our upcoming projects, you can apply at bassconnections.duke.edu. The application actually closes today at 5 p.m. So if you're interested in applying, then you have to do that today.
There may be a summer recruitment for incoming students as well. So if you are not quite at Duke yet, don't worry, there's almost always a second opportunity to get involved for fall.
Oh, great. Thanks, Sarah. So here are our Margolis projects that are part of BASS Connections reoccurring themes. And then here are our new upcoming projects that are part of BASS Connections open theme, which is a new section of projects that BASS Connections has now. So next up is the Scholars Program. For Duke medical students, our application is now open. You can find the application on our Scholars page on our website at healthpolicy.duke.edu/scholars. I'll actually be sending this PowerPoint to all of our attendees at the open house today. and so you'll be able to access it later. So you'll get all these links. Our application for undergraduate Duke students is now closed. We will announce the application open date for the 2021-2022 academic year later this year. And the application for graduate students opens April 1st. Another way you can get involved is our internship program, which takes place in the summer. Our internship program is very unique. Not only do our interns gain professional experience, but they also develop strong networking and mentoring relationships. This is because our internship program has a mentorship component where all of our interns are matched with a mentor or a research team, and they work on research projects over the course of 10 weeks. Oops. For our internship program, we welcome Duke and non-Duke undergraduate and graduate students who have a strong interest in health policy to apply. Our internship application for the summer of 2021 is now closed, and we are currently in the selection process. We'll be announcing our new cohort sometime in March, but our application for the summer of 2022, so next summer, will open this December. I would recommend following us on Instagram and Twitter at Duke-Margolis, because that's where we post all of our live updates. And if you follow us there, you'll be the first to know when our application opens. Another way you can get involved is through the Margolis seminars. Most of our seminars cover research or policy analysis in progress, while others include presentations by faculty, staff, and visitors on significant newly released research or legislation. Seminars are held approximately twice a month throughout the year on Fridays from 12 to 1:30 p.m. Normally they happen on Zoom, well, right now, and they actually require registration to access. And at this time, attendees for our seminars are restricted to those who are affiliated with the Duke community. But the Margolis Center actually has a lot of workshops and webinars, which are generally open to the public. And if you want to attend any of these workshops or these webinars, you can find out more about our upcoming events on our website underneath the events tab. For those of you who are incoming graduate students, this is a health policy concentration that we recently developed. We also have other academic concentrations and certifications that are currently being developed. But for this concentration and others, you can contact your program advisor or coordinator to see if you are able to take courses in our program. Some objectives of this specific concentration are understanding the current United States healthcare systems, learning policy analysis, and developing advocacy skills, and more. Here is the framework for the program. So the framework would be to analytical classes, and there's some examples right under there, to electives with some examples, a capstone project where students pretty much will focus on health policy relevant faculty mentored research project, or they can also do an applied internship experience, which would be like working with a healthcare organization on a project that has something to do with the intersection of population health and health policy. There's also the 2-semester internship, and then there's a master's paper or thesis. Last up is SCOPE, the Student Collaborative on Health Policy. So this is a student-led group, and student-led undergraduate health policy organization at Duke. And we at the center work really closely with this group. Their mission is to unite students across disciplines and the university in a collaborative effort to increase awareness and opportunities in health policy. They do this through 4 domains, and the domains are campus engagement, career and professional development, health policy, education, and service and advocacy. They always have a lot of events. Most recently, I think it was last weekend, they had a case competition, and students were welcome to join on the case competition, and graduate students actually got a chance to mentor the students who were part of the case competition teams. I would definitely follow them on social media, and so then that way you can learn more about their programming and their initiatives. They always have open general body meetings that you can attend, and you can find out more ways to get involved with them or even with their committees. And all their contact information is there, and so if you have any questions, I would recommend contacting the co-presidents, which are Charlotte Thomas and Josie Lee. Okay, well, that brings us to the end of our open house. We still have a couple more minutes, but does anyone have any questions? Okay, well, I'll hang around for a second, but thank you to all of our wonderful panelists, and thank you to all of you for joining and engaging with us this afternoon. I would say stay connected with us and get updates on everything that goes on under center by subscribing to our newsletter or following us on social media, or just checking out our website whenever you can and see how you can get involved with us. Thanks again and have a great weekend.